So we know that hypertension is one of the leading preventable causes of cardiovascular morbidity and mortality. And every 10 millimeter reduction in blood pressure is associated with a 20% risk of 20% reduction of the relative risk of major cardiovascular events and a 13% relative reduction of all-cause mortality. One of the problems of treating hypertensive patients is that significant percentage of patients are either non-compliant or they're partially non-compliant. Either they're unable to take the medication or they're unwilling to take the medication for various reasons, either because of the adverse effects or because of whatever lifestyle they lead, and most often because of the adverse effects and of many antihypertensive medication. And we know now that this is a representation, as a animation representation of how renal artery denervation works with the Symplicity catheter. And it disrupts both the afferent and the efferent renal nerves. And it causes precisely, it causes, because of the spiral design, it causes a concentric and linear and longitudinal coverage of most of the renal nerves that are encasing the renal arteries. So we know 63% of nerves are quite close to the renal pelvis, and 30% of cadavers have been found to have accessory renal arteries, and that's why it's important for us to cover all the renal arteries, including the accessory renal arteries. And by ablating the afferent and the efferent nerves, we target the different pathways of blood pressure causation, causing a near uniform and 24-hour control of the blood pressure. After the initial encouraging results of the Symplicity 1 and the Symplicity 2 studies, and a little disappointment from the Symplicity 3, now we have very good evidence from the SPYRAL Hypertension-OFF, the SPYRAL HTN-ON trial, and as well as from the global Symplicity registry, and as well as the real-world experience of more than 20,000 procedures performed with the Symplicity system. And most of these trials have shown that there is a significant reduction of both the systolic and the diastolic blood pressure, which starts immediately, and this effect is often persisting over the long term. And this is persisting beyond 3 months, and in the and up to 6 months and up to 3 years, we have the data to show that there's a persistent reduction of blood pressure, both systolic and diastolic. And this is regardless of whether the patient is on medication or off medication, and it is there across all patient spectrum and across both the male and the female gender. And if you look at the safety outcomes, it was pretty much safe and hardly any complications except for minor vascular complications. And therefore, it is absolutely clear that renal denervation is a safe procedure. Whenever we recommend a procedure which is invasive for a disease such as so common as hypertension, it is important that the treatment has to be safe. And the renal denervation therapy very handsomely meets the safety criteria, and it's an extremely safe procedure. And with a sustained reduction of blood pressure when measured in the cardiologist clinic, and the effects are sustained beyond 3 years. And even the long-term data demonstrates that there's a durable benefit of renal denervation over time, and this is there across all the studies that have studied renal denervation. So how do we decide which patient needs renal denervation? It has to be a shared decision making. It has to involve the physician. It involves the physician recommendation, and it has to involve a significant amount of patient education and the patient-physician interaction and discussion, and resulting in a shared decision making. There are minor complications, and most of them are vascular. And we have to educate the patients that renal denervation is equivalent to one very effective medication. So it is possible that at the least outcome of renal denervation therapy is that the patient will be off at least one drug. And it's also important for patients to realize that after renal denervation, they are unlikely to become medication free. But majority of the patients have better controlled blood pressures with lesser number of drugs than they were taking before the procedure. And potentially, there are complications, but they're not very significant. So there are other types of devices for renal denervation. One of them is one that is already studied and in the pipeline is the ultrasound-based renal denervation. And there are available the recall Paradise system, and this is the Paradise ultrasound renal denervation system. So this system gives a ring of ablative energy up to a depth of 1 to 6 millimeters, and the arterial wall is protected by water circulating through the balloon. It's like a balloon giving ultrasound. 2 to 3 sonications lasting 7 seconds are delivered to each main renal artery. This is the Radiance hypertension solo trial, which has showed encouraging results and offering that there is a second modality for renal denervation apart from radiofrequency ablation. But however, as of now, the standard device that is available for us is the Symplicity device, which is a radiofrequency energy mediated device. So in conclusion, renal denervation therapy is a powerful tool for hypertension control in patients who are requiring multiple drugs and whose hypertension is resistant to treatment. In future, it may be possible for us to offer renal denervation as a frontline therapy for patients who are unwilling or unable to take medication. Thank you very much.